And welcome back to Ask the Doctor. I'm your host, Mike Berger. Here to answer your medical questions on pain management today is Dr. Robert Bulger from the Southwest Pain Group. Just call the number that you see on the screen. It's 1-888-572-4411. Or visit the website at www.southwestpaingroup.com. Doctor, we talked about this pain mapping today, and every time we get together, you come up with some new and interesting things that are taking place. What's on the horizon? What are some big changes that you've seen or that you're looking for?
Well, I think one of the most exciting things about pain management for me is the fact that it's really turned into a specialty in of its own. When it started out in the 1950s and 60s, it was just an anesthesiologist doing a nerve block once in a while. You might be a surgeon that'd call me and say, hey, Bob, I got a lady in the recovery room that has pain. But now it's actually turned into a complete specialty. We're consultants. We help try to find the pain with pain mapping. We're using things like ultrasound, working with surgeons. It's an exciting field because we can actually integrate your complaints, our knowledge of neuroanatomy, and all the other exciting tools we have to give people answers. You don't have to just tell people, we don't know why you're hurt, just take these pills.
So if we take a section of time, let's say the last 40 years, we've gone from, well, we can make the pain go away for a while, or we can put you on medication, to we can actually do something about it and hopefully fix it.
We can't always cure pain, Mike, because sometimes there's nerve damage or structural problems we can't fix. But being able to tell a patient why they hurt, that's actually comforting, and there's a lot to do. There's a lot we can do to help it, and that's why it's called pain management. Obviously, I wish we could cure everybody, we can't, but we can sure help people get closer to the cause.
Now, I would like to go back for just a second to the pain mapping that we just talked about. This is a very interesting area. So who came up with this, and how has it evolved?
Well, actually, it's interesting. It's actually an offshoot of what we've always been doing. When I came here about 20 years ago, there were surgeons I was working with who were calling me and saying, look, I think that C7 nerve on the right is the one. Can you do a block and find out? And it kind of evolved from that. It was working with surgeons who have great knowledge of anatomy, of course, and trying to locate the pain generator. And it's called mapping because people can put their arms around that concept.
Sure.
But it's really discrete diagnostic blocks using our knowledge of neuroanatomy to find the problem.
I like pain mapping. And what about the future, quickly? Anything on the horizon that you find very exciting?
I think it's just the fact that pain specialists are actually going to become more and more necessary because evidence-based medicine is saying, look, we can't just give people pills, and we just can't do things without having a cause. We need to know what the cause is. So we're finding ourselves busier than ever because pain is the most common reason you visit your doctor, and people need to know why they hurt.
And I would imagine that if we can find the pain, if we can aid in the pain going away, or at least managing the pain, this is going to be cheaper in the long run for everybody involved as well.
Well, yes, because, you know, again, there's controversy about surgery and costs and medications. If we're going to use medications and surgical procedures wisely, we need to know why people hurt and where they hurt. And so it's a great teamwork approach working with our surgical colleagues.
Zero right in on it, and we can get it done.
Yeah, it's exciting business.
That's fantastic. Thank you, Dr. Bulger. We're going to take a short break, and then we'll be back with some more questions from you, the viewers. Stay with us.